Most aneurysms, even aneurysms that are large, 5, 6, 7 centimeters, most of these aneurysms, they don't cause any symptoms whatsoever. And that is why it is important to have a diagnostic tool to detect an aneurysm. But most patients actually have an incidental test. For instance, they would have a kidney stone, or they would go to the emergency room with abdominal pain due to something totally unrelated to their aneurysm, which they have, but they didn't know about it. And it's through an ultrasound or a CAT scan, a CT scan, looking for something to explain the patient's symptomatology when they present to the emergency room or to their primary care physician, whatever. And then we get a CAT scan and say, oh my God, there's a large aneurysm. So usually that's how they're detected. But 90% plus of aneurysms are asymptomatic. What it means is that you may be a 65-year-old healthy man, running every day and keeping your health in check. And then you may actually have an aneurysm and you wouldn't know about it. People who are at risk of having an aneurysm, it usually, I wouldn't say usually, but there's a strong family history. So there's clearly a genetic component to this. But smoking cigarettes over a long period of time has also been associated with higher incidence of developing an aneurysm. Diet, maybe diet related as well. But the genetic, the family thing is probably the strongest predictor of having an aneurysm. Many patients we do see have an aneurysm. I always ask, do you have anybody in your family that you may know who's had an aneurysm? And more often than not, people will say, well, my grandpa had an aneurysm, or my uncle. So it clearly runs into family. And it's important to know that, because many patients, they have siblings that are, who are alive. And so I obviously tell patients to actually convey that information to their close ones, their loved ones, so that they can have an ultrasound, which is a very easy test to perform to detect an aneurysm that's otherwise silent. I think the recommendation would be that if you are 60 years old or older and you do know that there's a strong history of aneurysms in your family, the recommendation would be to undergo an ultrasound, which is a fairly easy test and relatively not expensive test, which is very sensitive to detect an aneurysm. These would be our recommendations. If you don't have an aneurysm based on an ultrasound, there's no reason to repeat that ultrasound every year. But if you have an aneurysm that, let's say, measures 3 centimeters or 3.5 centimeters, then we would recommend to get a testing again every year, just to make sure the aneurysm is not growing. Because if the aneurysm is growing, that's where we want to catch it, and we want to be able to repair it to avoid the aneurysm to rupture with its obviously deadly consequences. There may be an acute event with back pain, but if the aneurysm truly ruptures, it sort of exsanguinate internally, and so you would become unconscious very quickly and probably die. If you're lucky enough that you have a ruptured aneurysm, but the rupture is contained, meaning that you're not really bleeding to death, but you are hypotensive, your blood pressure may be lower because of the events, and you have time to get to the emergency room, these are the patients that can be saved. But if you may be sitting at home or even driving your car, and if you rupture an aneurysm, you can die very quickly from a rupture.